Hello, welcome back to Dr. Hayatu's medical session. Today we'll discuss the indication of chest tube insertion. Don't forget to subscribe to our channel. Let us start. Chest tube insertion, also known as thoracostomy, is a medical procedure used to drain air, blood, or other fluids from the pleural space, the area between the lungs and the chest wall. This procedure helps re-expand the lungs and restore normal breathing. The concept of draining the pleural space dates back to ancient times, but the modern technique of chest tube insertion was significantly developed during the 20th century. Dr. Heinrich Braun, a German surgeon, is often credited with refining the procedure in the early 1900s. The widespread use of chest tubes became more common during and after World War II due to advancements in thoracic surgery and the treatment of traumatic injuries. Indications for chest tube insertion include pneumothorax or collapsed lung to remove air from the pleural space, hemothorax to drain blood from the pleural space, pleural effusion to remove excess fluid which can be due to infection, malignancy, or other causes, empyema to drain pus resulting from infection, chylothorax to drain lymphatic fluid accumulation, post-surgical care after thoracic surgeries to prevent complications. Preparation. First, obtain informed consent. It's crucial to ensure the patient understands the procedure and any potential risks involved. Next, position the patient, typically in a semi-upright position with the arm raised above the head to fully expose the insertion site. Finally, administer local anesthesia to the insertion site to minimize discomfort during the procedure. Insertion. Begin by making a small incision on the skin, usually in the mid-axillary line, which is between the 4th and 5th ribs. Carefully dissect through the muscle layers to reach the pleural space. Then, insert the chest tube through the incision and advance it into the pleural space. Once the tube is in place, secure it with sutures and apply a sterile dressing. Lastly, connect the tube to a drainage system, often with water seal or suction, to ensure proper function and drainage. Post-insertion care. Monitor the patient's respiratory status and chest tube function. Regularly check for signs of infection, blockage, or air leaks. Obtain chest X-rays to ensure proper placement and lung re-expansion. The duration of chest tube placement depends on the underlying condition and patient's response to treatment. Generally, a chest tube may remain in place for several days to a few weeks until the lung has fully re-expanded. In cases of pneumothorax, fluid or air drainage has significantly decreased or stopped, and the underlying condition has resolved or stabilized. Indications for removal. Minimal drainage less than 100 to 150 milliliters per 24 hours. Absence of air leak for pneumothorax. Radiological evidence of lung re-expansion. Resolution of the underlying condition such as infection control in empyema. Risks and complications. Infection, the risk of introducing bacteria into the pleural space or at the insertion site. Bleeding from injury to blood vessels during insertion. Organ injury, potential damage to the lung, diaphragm, or abdominal organs. Pain, discomfort at the insertion site. Subcutaneous emphysema, air leaks into the tissues under the skin. Malposition, incorrect placement of the tube requiring adjustment or reinsertion. Chest tube insertion is a critical procedure for managing various thoracic conditions. Understanding its indications, technique, and potential risks is essential for healthcare providers to ensure effective and safe patient care. If you found this information helpful, subscribe for more health-related content. Thanks for tuning in, and until next time, stay healthy.